Hi, my name is Mohamedin Diamalon, a nursing student from Notre Dame of Taporong College of Nursing. So today, I will be performing and demonstrate on patient's bed bath. Definition: it is a type of bath given while the client in bed. The purpose is to make a client clean and feel comfortable, to increase a sense of well-being, and to promote muscular relaxation and relieves feelings of fatigue. The equipment to be used: wash basin with full of warm water. Next is bath blanket. The next is bath towel. Next is wash cloths. Patient's gown. Hamper for soiled linen. Gloves. Soap. And the hygiene supplies composed of lotion, powder, and deodorant. And the last is bedpan or urinal. Now let's proceed to the procedure and the rationale. The first is assess the client's tolerance for the activity and explain the procedure. Rationale: to determine the client's ability to perform self-care, level of assistance, and promotes cooperation. Good morning po sir. Ako nga po pala si Mohamed India Malon, ang nurse mo sa araw na ito. Kamusta po kayo?
Okay lang.
Okay lang. So sir, ngayon po ay maliligo po tayo or lilinisin natin ang inyong katawan. Okay lang po ba?
Okay.
Okay. Sir, kaya niyo po bang igalaw ang inyong katawan? Kaya. Okay. Sir, pwede niyo po bang itaas ang inyong kamay? Okay. Okay. Sir, kaya niyo po bang tumagilid? Very good. Thank you. Okay. Next is adjust the room temperature and ventilation. Rationale: a warm room prevents rapid loss of body heat during bathing. Next is provide the privacy by drawing the curtain and closing the door. Rationale: to allay fear and anxiety. Next, offer a bedpan or urinal. Rationale: the client will feel more comfortable and allow continuity of work. Sir, gagamitin natin ito mamaya sa paglinis ng inyong private part.
Opo.
And now, wash your hands and wear a clean gloves. Rationale: to reduce the spread of microorganisms. Now, adjust the height of the bed to a comfortable working height position. Rationale: to prevent the muscle strain on the part of the healthcare provider. Next is Remove the top sheet by placing a blanket over the client before removing the top sheet. Rationale, the blanket provides warmth and privacy. Next, remove the client's gown while keeping the client's covered with a bath blanket. Rationale, to provide full exposure of the body parts during the procedure. Next is, uh, take note, if the client has an IV, remove the gown first from the arm without IV, and do not disconnect the tubing. If any extremity is injured, remove the gown first from the uninjured side. Rationale, undressing the unaffected or uninjured side first allows easier manipulation of with body parts with a reduced range of motion. The next is, pull the side rail up and fill the wash basin with the 2/3 full warm water. Rationale, to maintain the client's safety, and warm water promotes comfort and relax of muscles. Next is, remove the pillow if allowed, and place the patient in a semi-flowers position. Spread the bath towel across the patient's chest, tucking under the chin. Rationale, removal of the pillow makes it easier to wash the client's ear and neck. Next is, make a bath mitt of the washcloths. Rationale, to protect the client's skin from the nails of the healthcare provider. And meat meat retains water and heat more than a loosely held cloth. Next is, wash the client's eyes with a plain water moving from the inner canthus of the eye to the outer canthus of the eye, and use separate portion of the washcloth for the eyes. Rationale, soap will irritate the eyes, and just take note that do not use the same side of the towel when wiping the eyes. Next, wash the client's face, ears, neck with or without soap as per client's preferences. Rationale, soap tends to dry the face, which is exposed to air more than any other part of the body. Next is place a bath place a bath towel lengthwise under the arm and that is away from you. Wash a client's arm with a soap and water using a long firm strokes from distal to proximal and including underarm. Rinse and dry, then wash the client's hands. Next is repeat the procedure on the client's other arm and hand near you. Rationale, washing first the arm and hand of the client away from view and healthcare provider prevents contamination of dirt from the arm near to the client. And next, fold the bath towel and lay of the bed beside the clients and wash both hands. Next is place a bath towel over the client's chest and fold the bath blanket down the pubic area and wash, rinse, and dry chest and abdomen using a long firm strokes, paying attention to the skin folds. Rationale, skin folds accumulate dirt. And the next is cover the client's chest with a blanket, then remove the towel. Next is replace the bath water for sanitary purposes. Next is expose one leg and foot time by folding the blanket towards the midline and place the towel under the calf of the leg and that is away from you, then wash with a long firm stroke. Rationale, to provide warmth and privacy to the client. And the next is repeat the other leg and other foot near from you, rationally, to provide warmth and privacy. And the next is immerse and wash feet, the wash basin and fat dry through between toes. Okay, so I already washed the foot and replace the water for the sanitary purposes. Next is turn the patient on his or her side facing away from you and place a towel alongside with back. And then wash starting from the shoulder going down to the buttocks using the long firm strokes, giving special attentions to the gluteal folds. Rationally, dirt accumulates of the fold of the buttocks and the anus. So sir, tatagilig po tayo doon, papunta doon ha. Bibilang po ako ng 3, then tagilig tayo. Itaas ko muna itong isang paa mo ha. Ready? 1, 2, 3. Yan. Very good. And the next is, if the client is unable, place the client in a supine position and cover with a bath blanket. Then wash, rinse any dry perineum from the front down and front down near you. Then giving a special attention to the skin folds. If the client is able, place a towel under the buttocks and bring a wash basin soap with the patients, and bring the wash basin with the patients. Then instruct the client to complete the bath, her or himself. Rationally, this is to provide privacy and comfort. So sir, ngayon po ay lilinisan natin ang inyong private parts. So, kaya niyo po bang gawin na kayo lang, sir?
Opo.
Okay. So, maglalagay ako ng towel dito, sir, at ng warm water, ha? Okay, hawakan nyo po. Nandito po ang tubig. Linisan nyo lang po. Okay. Thank you po. And the next is, assist the clients to put on a clean gown, comb hair, dry or deodorant powder, and lotion. So, the desired of